Welcome to Your Family's Health, the program that focuses on healthcare issues with unique and different modalities for taking charge of your health today. Experts talk weekly with our continuing roster of guests from around the country and right here in Nassau County to keep you up to date on the latest health issues and trends. Take care of your mind, body, and soul. Spend the next half hour with the voice of Nassau Community College, 90.3 WHPC, and get on the journey to better health.
Hello and welcome to Your Family's Health. My name is Dr. Jeanine Cook-Garard from the nursing department here at Nassau Community College. And today you're going to learn about ovarian cancer and the organization called the National Ovarian Cancer Coalition, whose mission is to save lives through the prevention and cure of ovarian cancer and to improve the quality of life for survivors and their caregivers. Our first guest today is Stefanie Taylor, the Northeast Senior Regional Manager of the National Ovarian Cancer Coalition, along with Vesna, a local woman from Long Island who is an ovarian cancer survivor. Stefanie and Vesna, welcome to Your Family's Health on the voice of Nassau Community College, 90.3 WHPC. Welcome.
Hello.
Welcome. Thank you so much for having us today. We really do appreciate it.
It's good to have you. What a great topic. And Stefanie, let's first start with you, if you don't mind. Tell us about the National Ovarian Cancer Coalition. Tell us what it's about and its mission.
Absolutely. So you actually captured it beautifully when you, and I will just reiterate, the mission of the National Ovarian Cancer Coalition, or NOCC as we call it, is to save lives through the prevention and cure of ovarian cancer and to improve the quality of life for survivors and their caregivers. Our work is grounded in 4 pillars and supports the health priorities of the ovarian cancer community. And our 4 pillars focus on early awareness, quality of life initiatives and programs that help survivors throughout their continuum of care, community events, as well as impacting critical research.
Very good 4 pillars, and I think they're very encompassing when it comes down to ovarian cancer. So when a woman goes to a gynecologist for the annual exam, is she tested automatically for ovarian cancer?
Great question. And this is one of the questions that has the greatest misconception in our community. When a woman goes to a gynecologist and has a pap smear is only going to be testing for cervical cancer. Currently, there is no early detection test for ovarian cancer. And that is why knowing what the subtle signs and symptoms of ovarian cancer are is extremely important for a woman, because that knowledge and education is what will empower them to be able to advocate for themselves.
So the pap smear only shows the cervical cancer. So how is ovarian cancer diagnosed?
So if a woman is experiencing some of the signs and symptoms of ovarian cancer, which could include bloating, pelvic or abdominal pain, trouble eating or feeling full quickly, a sense of urgency to go to the bathroom quite often, lower back pain, fatigue, menstrual changes, or changes in a gastrointestinal system. And sometimes also it can be combined with painful intercourse. If these symptoms occur for 2 weeks, we would suggest to any woman that they contact their doctor immediately. And if cancer is suspected, that they should actually see a gynecological oncologist. And from that, a woman could have a transvaginal sonogram and have a CA-125, which is a marker that is not utilized universally for all women. But if somebody is at high risk, or if they are suspecting somebody, they may be able to do that test. It's a blood test that would detect a protein marker that is elevated in women that have ovarian cancer. And also, the most important thing is, if you feel something, say something, because all of these symptoms that I did share with you, unfortunately, they are subtle, they are vague, and they also can be attributed to several other benign types of illnesses. And that's why if a woman knows, know your body, know yourself, and advocate for yourself.
So
Can't stress that point enough.
Yeah. So this ovarian cancer, when you go to your gynecologist, is this something that you should be proactive and actually suggest to your gynecologist? Can I be tested for the transvaginal sonogram? What are some of the things that you can ask for to be proactive?
Again, if you're feeling these symptoms, because we're not here to alarm the listeners out there, we are here to alert them about what the subtle signs and symptoms are, and also to make sure if these symptoms are lasting for 2 to 3 weeks, that you go to have a visit with your gynecologist. You explain what your symptoms are. Track your symptoms in a diary or a journal. So this way you can have a conversation. You can say, well, I was feeling like this. They are very subtle, but if you actually listen to your body, women will say, I didn't even know that was a symptom. I didn't know I should have talked to the doctor about that. Mm-hmm. And that is the most important thing. And also knowing your family history is extremely important, because 1 in 78 women will be diagnosed with ovarian cancer in their lifetime. And we need to make sure that, unfortunately, as with a lot of women's healthcare issues that are swept underneath the rug, we need to find our voices to be able to feel comfortable when we go to the gynecologist to be able to have this dialogue.
So there is a familial link. What are some of the other risk factors that you can discuss?
Absolutely. So anyone born a female is at risk for ovarian cancer. Being postmenopausal, being overweight or obese, and then having a family history of ovarian, breast, or colorectal cancer can also lead to ovarian cancer. Having an inherited genetic mutation. And unlike other types of cancers, such as breast cancer or prostate cancer, without there being an early detection test, knowing your family history, when you're sitting down, the holidays are coming in April, it's a great time to sit there and kind of have a discussion with your family members. What cancers run through our family? What is our family history? Because having a family cancer syndrome, or having inherited genetic mutation. A lot of people have heard of BRCA1 and BRCA2 genes, but those are not the only genes that somebody could have that could lead to ovarian cancer. So we want to make sure you have that family history. And once you know that family history, because with ovarian cancer, most cancers are sporadic, but with ovarian cancer, the genetic mutations can be as high as 15 to 20% of the cases. And with that said, what we want to make sure is that women, once they get that information, you take the time to share it with your healthcare team. And that is really a critical piece of advice, whether it's your primary care physician and your gynecologist. You want to make sure you share this information.
So you talk about sharing the information with your primary care provider. Would you suggest that this information be shared specifically to your gynecologist?
Yes, absolutely. We would encourage all women to share any family history that they are aware of about family members with cancer diagnosis with their gynecologist as well as with their primary care physician.
So how is ovarian cancer treated? What is the standard treatment?
Well, it really would depend upon the type of ovarian cancer that a woman is diagnosed with. There is the primary kind, or the most common kind, is called epithelial ovarian cancer. There also is stromal cell and germ cell. But traditionally with ovarian cancer, most women will encounter chemotherapy treatment. They also will do surgery for their ovarian cancer diagnosis. And some women, depending upon the type that they have, they may be put on other types of medications, such as hormone therapy. But traditionally, it is with surgery as well as with chemotherapy. And some women actually also undergo radiation treatment.
You're listening to Your Family's Health on the Voice of Nassau Community College, 90.3 WHPC. My name is Dr. Jeanine Cook-Garard, and today we're learning about ovarian cancer and the organization called the National Ovarian Cancer Coalition, whose mission is to save lives through prevention and cure of ovarian cancer and to improve the quality of life for survivors and their caregivers. Our guests today are Stefanie Taylor, the Northeast Senior Regional Manager of the National Ovarian Cancer Coalition, along with Vesna, a local woman from Long Island who is an ovarian cancer survivor. So, Vesna, I want to ask you some questions as an ovarian cancer survivor. Thank you first for being here and sharing your story. So, when were you diagnosed with ovarian cancer?
So I was diagnosed approximately, well, first of all, thank you so much for sharing light on this important topic. So many women are just so unfamiliar with signs and what to look out for. So thank you so much for that. I was diagnosed about 2.5 years ago, and it feels like yesterday, yet it seems like a lifetime ago.
So what was that like? How did you find out that you had ovarian cancer? What are some of the signs that you experienced to lead you even to go to the gynecologist to look into this?
Right. Because considering all of the symptoms that that Stefanie just mentioned, it's overwhelming. And women, I'm sure, listening to this saying, I have all those symptoms. What do I do? Do I have cancer? And that's not what we're trying to do. Women, we feel different symptoms all the time. This does not mean that you have to be worried and think that that's your diagnosis. Please do not think that that's it. But it's extremely important to listen to your body. Your body is, it tells you that there's something wrong. I am fortunate enough that I advocated for myself because I was misdiagnosed a few times. So I am a very active woman. I coach basketball. I do martial arts. I run. I do so many active things. And I have 3 small kids who I keep up with. I woke up one day with a very bloated stomach. And I said, oh, that's weird. Did I eat too much brownies yesterday? What was it? And then I thought, okay, I'm just going to keep a little, be aware of my weight. It wasn't that. It was getting worse and worse and worse. And I looked 4 months pregnant at a point, and it happened very quickly. From the first moment that I noticed that there was something wrong, I would say about 2 weeks later, I looked about 4 months pregnant. So I did make appointments to the gynecologist, and I was misdiagnosed twice. I was told different things. I was told that I could possibly be constipated. That wasn't it. I was told
probably irritable bowel syndrome, probably.
Such crazy things. Yes. And I was doing everything possible. I read, don't go online. I went online. I tried to do whatever the internet told me to do. But I knew I never in my wildest dreams thought cancer, but I just knew there was something off and something wrong.
Does cancer run in your family?
I had a grandma who died very young of breast cancer. She died at 52. Yeah.
So what was the diagnostic test that definitively told you or your practitioner that you were positive for ovarian cancer?
Well, I had a very different situation happen, which I went into surgery to have a cyst removed. Now, it was a complex cyst, so they weren't sure. They never really mentioned cancer to me, but they did make me thought it was a wise decision to go see a gynecological oncologist. Hearing the word oncologist, I, of course, instantly panicked. I said, why? Why would they think that they need to see me? But they just did it just to be safe, because once they opened me up, they figured it's better safe than sorry to have an oncologist there. Very wise decision, because when I woke up from surgery is when I was told that I had cancer.
Take me through the emotional toll that you had subsequent to that story, that news.
Well, considering I had 3 children, they are what instantly came to mind when I woke up in the hospital. My husband had to tell me. The nurses thought that it was quite humorous that I had a bad word, and I instantly felt anger. I know that a lot of women don't feel that. I know a lot of women cry and have a different emotional outburst, but I instantly felt anger. I felt like my entire life I've eaten correctly. I've taken care of my body. I take supplements. I always just felt that I did the right thing. So why would this happen to me? So that's where my mind frame went.
Mm-hmm. Yeah, why me? Yeah.
Why I felt I was very young. I felt I was doing all the right things, and it was a very shocking moment. I don't wish that on anyone.
So describe for me your treatment.
Well, like I said, I went in for a regular cyst removal, and considering the size of it, it was the size of a football, or what my doctor said, a seedless watermelon. So they did open I have a large incision on my stomach, and it was 4 days in the hospital. It was, I believe, a few weeks after that, I went into chemotherapy. And that was 8 or 9 cycles of chemotherapy, which by far was the hardest thing for me.
So now you're cancer-free?
I am currently cancer-free. Okay. I do get checked every 3 months. I do get skin anxiety, is what they call it.
Yeah.
Yes, it's a definitely something to celebrate, but it is also something to not take for granted. I speak to every one of my friends. I don't know why this happened to me, but I feel like if one person can hear my voice, just please, when you go see your gynecologist, you have to speak up. You have to say, please check me. I know that there's an internal sonogram is how they can check for possible ovarian cancer. I never knew this. I always tell my friends to please be mindful of your body. If you feel anything off, we're women. We tend to put everyone in front of us. Yeah. We put our children, our husbands, everyone, our studies, or anything in front of us. And I really need to push any women, any girls listening. You have to just take care of yourself first. We can't take care of others if we don't take care of ourselves. There's so many questions that you need to ask. If you feel anything, ask. Choose a doctor carefully. Don't just go to someone who is in your town. Choose someone carefully. Ask for help. Ask for love. Loved ones want to help. They just don't know how. Ask for help and let them help you. My husband never missed an appointment with me. He was there from the start. And I love that because I was emotionally invested. He wasn't. Of course, he clearly was, but he was more clinically and medically invested. So he took all the notes. He asked all the right questions. So it's so important to bring someone with you, lean on them, learn about your diagnosis. It's so important to learn about it, ask the proper questions. Don't feel bad about asking the questions. The questions are so important. They could save you. They can give you the right treatment. And then joining a support group, the NOCC, Stefanie reached out to me very early on when in all reality, I did not know one ovarian cancer patient. I didn't know what to ask. She reached out to me and I entered this group of ladies who welcomed me. I feel like the first hour, I felt like they were sisters. They knew exactly what I felt. They knew exactly what I was feeling. And they just embraced me and gave me their phone numbers and said, call me anytime. Stefanie reached out to me and provided beautiful things. She said, do you need anyone to clean your home? We can send someone. Do you need food? Do you need anything you need? We're here for you. And I needed that because my family was trying to be supportive, but they did not know what I was feeling. They wanted to help, but they just did not know how I was feeling until this group of ladies in the NOCC, they knew, and they knew exactly what to say to me, exactly what I needed to hear. And I'm cancer free. I don't even know if I could say cancer free because I'm still in the process, but it's been 2 years and they're still part of us. We met to go walking the other day. We're just a big support group, and it's so important for someone to reach out if they need that.
So, Stefanie, how many women share, this symptom? I know Vesna talked about it, where they're dismissed because of their symptoms, and these symptoms are attributed to benign types of illnesses. How should a woman proceed if this occurs?
Great question. And I read a great article once, and that it was termed the DID effect: dismiss, ignore, deny. We as women, as Vesna said, we put everybody else first in our lives, right? Whether it's our jobs, careers, family members. And also what happens though sometimes is that when we do finally find our voices, that sometimes a doctor may dismiss, ignore, or deny what you may be feeling. And that is why you really do need to advocate for yourself. Vesna doesn't share a great part of her story about how persistent she was to find an answer she literally sat in a doctor's office and would not leave until somebody saw her. That takes great inner strength. Yeah. And she demonstrated that over and over again throughout her journey. But I think what's really important, if you feel that your doctor is not responding to you, find a new doctor. That's what we tell women all the time. Your medical care team, you get to choose them, and you want to choose people that you feel that are going to be with you throughout your lifelong journey. And so you need to make sure that you have a connection and that you could talk honestly and openly with them, but find your voice to advocate for yourself.
You're listening to Your Family's Health on the voice of Nassau Community College, 90.3 WHPC. My name is Dr. Jeanine Cook-Garard, and today you're learning about ovarian cancer and the organization called the National Ovarian Cancer Coalition, whose mission is to save lives through the prevention and cure of ovarian cancer and to improve the quality of life for survivors and their caregivers. Our guests today are Stefanie Taylor, the Northeast Senior Regional Manager of the National Ovarian Cancer Coalition, along with Vesna, a local woman here in Long Island who is a ovarian cancer survivor. So Stefanie, back to you. Can you share with us some of the programs and services that the National Ovarian Cancer Coalition provides for survivors? I know Vesna was talking about the emotional support that she was given through this great coalition, but are there any others? You talked about 4 arms. Anything outside of that? Yes.
Absolutely. And I think that one of the things that we did recognize that because of COVID, all of our programs went virtual. And because of that, we recognized the fact that women had greater access then. So for our support groups. So we do have virtual support groups that are there to help a woman throughout their journey. And as you could tell from Vesna, how meaningful being able to connect with somebody with a shared experience meant to her. In addition to that, we also have direct support programs that provide concrete services to women and during this uncertain time of their life. So, for example, we have a program that's called Comfort for the Soul, which is a meal delivery service program that is for women that are in active treatment or recovering from surgery. And we also just recently launched a new financial assistance program for those women that are in active treatment or on a clinical trial. And in addition to that, we recognize that women, emotional health, right? There's layers of support that women need. And we have another program that's called Comfort for the Mind, where we partner with an organization called BetterHelp to provide mental health counseling for women because going to a support group is one layer of the support. Mm-hmm. They also need to seek counseling either within their own community, but if they cannot find that, some women are able to find that through our relationship and partnership with BetterHelp.
Vesna, just curious, in your journey with ovarian cancer, what would you do different? When you look back in retrospect, is there anything that you would have done differently?
I don't think I would have done anything differently because I spoke to a lot of my chemotherapy nurses, and they are actually Facebook friends of mine now. And they said that a lot of girls that they speak to did not do anything along the lines that I did. Mm-hmm. Now, what Stefanie was mentioning, when I was misdiagnosed, I went to see 2 different doctors within 2-3 weeks time frame. They told me that I was fine. And I was driving and I saw my primary doctor and I walked in. I'm a very sweet person. I don't ever have conflict with people. And I walked in and they said, "Oh, Vesna, there's no one available to see you. The doctors are booked." And I said, "Well, I need to see someone. I don't care who it is. If it's a physician assistant, anyone, I'm going to sit in that chair right there. Well, we're going to lunch soon." And I said, "Then I'll sit right there until lunch is over. I'm not leaving here until somebody sees me because I know that something's wrong with me and I need to sit." You. And I remember thinking, oh, my children are getting off the bus in 20 minutes. And what am I doing? I'm acting so tough when I'm really not this tough. But I just knew. And a PC, a primary assistant, a physician's assistant, PA, said she'll see me. And I laid on in the office. She touched my belly and her face turned blank. And she said, "I need you to go across the street and get a scan done." And I said, "Well, don't scare me. Do I have gluten allergies?" That's what I said. "Do I have gluten allergies?" And she said, I need you to go right now. She knew instantly. My cyst and the tumor inside was so big that it was pushing all my other organs up. That's why I was having trouble sleeping. I was having trouble breathing because everything was pushed up. And she felt organs that should not be this high up towards my chest when they should be lower. And when I saw the scans, it was the most petrifying thing I've ever seen. It was this huge mass in the middle of my stomach with all my other organs all around it. It was consuming entire midsection. And I went home and I said to my husband, I think we have a problem. And so I don't think I did anything wrong because I pushed and I pushed and I pushed. And a lot of my friends who I do speak to who also went through treatment and are unfortunately not here any longer have told me that they felt pain, they felt symptoms, and they let them go, and they thought it would get better and they let it go. And I urge women, please listen to your bodies. Your bodies are your temple. Why treat it otherwise? Please listen to your bodies and take the right steps. Speak up for yourself, because I'm here because of that. And my children have a mother because of that.
That's good. Your body is your temple. And sometimes instinctually, you know what's going on, even though no one tells you. So where can someone get in touch with you? How can they get in touch with you? The National Ovarian Cancer Coalition. Do you have a website?
Absolutely. If somebody is interested in getting in touch with our organization, they could go onto ovarian.org and they can learn about our organization, the various programs and services that we provide, and the continual educational programs that we also provide to women throughout their survivorship. And one other point that I want to make that Vesna shared with you is about how some other women kind of ignored their symptoms. And that is one of the other reasons why ovarian cancer is also very unique, because it is very often diagnosed in the later stages when it is much more difficult to treat. And that is why we need to continue to spread awareness about the signs and symptoms, have women know that they have the ability to raise their voices when they need to, as Vesna did. She is the optimal example of what it means to advocate for yourself.
So any follow-up care now, Vesna?
Aside from my scans every 3 months, I continue to take care of my body and I continue to eat properly. But other than that, my doctor gave me a green light and she says, live your life, enjoy your babies and live your life. And aside from the scans, that's all.
Wow.
Thank goodness.
What a great story. It was heartfelt. It was informative. And thank you for sharing it with us. And thank you for being here. Stefanie Taylor, the Northeast Senior Regional Manager of the National Ovarian Cancer Coalition, along with Vesna, a local woman here in Long Island who is an ovarian cancer survivor. We hope you stay safe, continue to enjoy your family, stay healthy, and thank you so much for being our guest today.
Thank you very much.
Thank you both.
Thank you for having us. Thank you.
This is Dr. Jeanine Cook-Garard from the Nursing Department here at Nassau Community College, and we want to thank you for listening to this week's edition of Your Family's Health.
We'd like to get your feedback on your family's health. Send your comments by emailing them to whpc@ncc.edu. Podcasts of today's show are available on iTunes, Android Podcasts, and Spreaker. This program was produced at the studios of Nassau Community College in cooperation with the Nursing Department. Join us next week for another edition of Your Family's Health on the voice of Nassau Community College, 90.3 WHPC.